Hello and welcome to Mandel's Clinical Pharmacy's PharmAssist program. Thank you for joining us tonight via either Zoom or Facebook. And we are very lucky to be joined today by Wanda Hofgesang, who is here to answer your questions and walk us through a couple of different fertility medications today. So as you can see, first up on the screen, I'd just like to share a quick disclaimer. The PharmAssist MedTeach program is brought to you by Mandel's Clinical Pharmacy and is intended only as an educational program for patients. Any clinic-specific information shared by the MedTeach nurses is the opinion of the nurse and is not intended to replace the recommendations or requests of your healthcare professionals. All medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. So, with that all said, we will touch on that a couple times just as a reminder. But I would like to welcome very much Wanda. Thank you for joining us tonight. And I would like to turn it over to you now, and you can start kicking off the program right now.
Great. Thanks, Craig. As Craig said, my name is Wanda Hofgesang. I am a registered nurse at an infertility clinic in the northern New Jersey area. And I was so excited to be a part of this program that launched this month, with every Monday night a 7 p.m. Zoom and Facebook Live video to be able to help our patients get through the task of injections for fertility. I've been a nurse for 26 years in fertility. I couldn't even believe that was my number when I thought about it, since 1994. And what I will say is the medications have changed greatly since then in a lot of good ways. In the sense that these medications now are a little more simplified in how they're delivered, and in the type of injections that they are, and also just ease of working with the products that are out there. Some of them are now in pens, which is so much easier to use. So it really has come a long way. And this great program that Mandel's has come up with is patient education has always been a big part of what I've done and what all of us nurses do at our fertility clinics. We have to make the complicated seem simple and simplify it a bit, because it can seem daunting, and we don't want that to be the case. We want you to feel confident that you can get through these cycles and through these medications with ease. And that's really the point of this video system. So make sure that you are able to join us each Monday night at 7 o'clock with different nurses and different videos. How it will work tonight is I have 3 videos that I will be sharing, and 3 of the medications for the fertility cycles. One is Gonoloft Red-Eject Pen, another is the Gonoloft multi-dose, and a third is Sonera patches, which are to help with easing the feeling you may get when you get your blood drawn, or with some of these injections. It's a little bit of a numbing agent. So we're going to go over all 3 of those this evening. And then after we do that, we're going to have a question and answer session. And I'll remind you to keep your questions, if you can, basically to the medication itself. I'm not here tonight to replace any information that you receive from your nurses, your clinics, your physicians, because we all do things sometimes a little differently, and we need to make sure that we're following the instructions specific for us from our fertility clinic. But I'm certainly here to help you with any of the questions that could arise from the specific medications. First, before we go into the first video, I want to mention something that I hear a lot about is opening the box. People get really concerned and afraid to do that. They receive the package from the pharmacy and they kind of store it, and then they don't open it until that very first night. And I think preparation and organization is really what's key into helping decrease any anxiety that you might have. So feel free, when you get that box, don't be afraid of it. Open it up, take a look at the packing slip, see the different items, even if they're hard to pronounce names, that's okay. Just open that up and make sure that the quantities are there of what's been ordered, and kind of organize things that way for yourself. Create a little space to use for your fertility cycle. I think that's a big tip that I can give you before we get started, is definitely opening that box before you get started and before you have to do that first injection. So I think I'll turn it over to Craig to show us that first video, which is going to be of the Gonoloft Red-Eject Pen. And then what we'll do after that video is we will have a Q&A session where you can ask any questions via Zoom or via Facebook. This medication video is to show you how to prepare and inject the Gonoloft Red-Eject Pen. First thing to let you know is if you are being prescribed the Gonoloft pen, mainly you're using that to help stimulate follicles or eggs, multiple follicles and eggs, to grow throughout your cycle. So Gonoloft is a stimulation medication, and it contains the hormone of FSH, which is follicle stimulating hormone. So that's the big one that's responsible, whether you're doing an insemination cycle or an IVF cycle. It's helping your body recruit and develop multiple eggs. Once again, I always like to ask or mention first, the supplies that are needed for the Gonoloft pen is one Gonoloft RediJect pen and one small needle tip that's provided for you with your pen. Your pen will come in a box, a kit of its own, and the needle tips and the pen will be in there as well. Couple little reminders about this medication is this medication is, again, a subcutaneous injection, like some of the different medications for fertility. So it's administered in either the lower belly or the upper top outer thigh area. That's routinely where, I know for me, our clinic, that's where we have our patients injecting. So you always want to follow your clinic and your nurse's instructions, but routinely that medication is administered in that lower belly and those upper outer side thigh area. So that's a subcutaneous shot. It's a little tiny needle. So again, you have an option where you could self-inject this medication or someone could administer it to you. There's no right or wrong. It's whatever works for you that helps you get through your cycle. So don't feel badly if you hear somebody else saying they give their own shots and you're not comfortable. We want you to always be comfortable with what you're doing in your cycle, and for everybody that's different. So whether you'd like to self-inject or have somebody give you your shot, whatever it takes to help you through the process is most important. With your Gonoloft pen, it may come from the pharmacy and it may suggest to keep it in the refrigerator. Based on the manufacturer's description with this in terms of keeping it refrigerated, if you keep it refrigerated, it's good until the expiration date. If you keep it outside of the refrigerator, it's good for the expiration date or 3 months, whichever comes first. So either or is fine. Oftentimes we just tell patients to put it in the refrigerator because then that gives you the whole time frame and you don't have to worry about calculating. It's just good until that expiration date. Can I take it out of the fridge before injecting? And the answer to that is absolutely. You can put it on the counter for approximately 15 minutes or so. It just brings it up a little bit from that refrigerator temperature and makes it a little bit easier, a little less feeling that you might notice when you inject that liquid. Typically, this medication will not sting, but you'll feel a little pinch with the needle. And sometimes if that fluid's cool, you might feel that too. So certainly you can put it out on the counter and let it warm up a little bit before you inject. So for your supplies, we have the Gonoloft pen. The first thing we do with that is we uncap this pen. And the next step is, it is sterile, guys, under there after the first time you use it, but it's just the nurse in me always has the habit of whenever I'm poking a needle into a surface, I clean that surface. So I'm cleaning the surface because I'm going to poke a needle in here. And the needle that I'm going to poke in comes with this product. It is a little needle tip. You just remove the little seal and then gently attach it. Don't over tighten because you are going to have to take that needle back off when you're done. So you don't want to over tighten too hard. So you just want to tighten it a little bit. And then next step is going to be to follow your clinic's instructions with your dosage. In here, what you will see is there is a little dial and there are some numbers. There, right now it's on 0. What you would do is you would turn to whatever dosage your clinic tells you. So I'm just going to turn this, and by the way, this dial can turn in either direction. So I'm going to turn this dial and I'm just going to simply set it to a dose of 150. So you might be able to see that in there, that it's a dose of 150. Again, that'll be determined by your clinic. The other thing I'll mention with this just quickly is a lot of times patients say, when will I know if it's empty? When you give a dosage after you inject, the dial goes to 0. When that dial goes to 0, that means that you still have medicine in that pen. So put it in the fridge and use it for your next injection. The goal of this pen nicely is that it's already mixed and it's multi-dosed, and you're going to use it up until you're done. Eventually what may happen is when you turn your dial to your dose and you give an injection, if there is ever a number that is not a 0 in that window after giving the shot, that's letting you know, hey, I couldn't give you that injection because I'm now empty. So you would discard this pen, open up and get a new pen with a new needle, and turn the dial to whatever dose this one stopped at after you finished your injection. So if it stopped at a dosage of 50, then you would open a new pen and give just a 50 unit dosage. The other thing I wanted to mention is the pen is multi-dose. The needles are one-time use. You always only put a needle on, give an injection, and discard that needle into your sharps container that will be given and provided to you by the pharmacy. So the pen itself is multi-use, but not needles. Needles are one-time use, and then you discard, okay? For injection technique for this one, like I said, just to show you that, it will go in either the belly or the upper thigh. So just to get our little mannequin here, in the upper belly, lower belly area, not upper belly because we have some muscle up there, and in our upper thigh, outer thigh area because we have some fatty tissue. So we want to avoid muscle. This is a fatty tissue shot. So if I were giving this mannequin an injection in her belly, I would have her possibly lay down like this, and I would administer the needle to go straight in 90 degree this way, straight in 90 degree this way, or if I'm giving it in the side thigh, it's 90 degree this way. So that would be if she were laying down and I were administering. If she's self-administering and she's standing or sitting, she would be in this position. So what we would want to do to get ready is the first thing is uncap your pen with the big cap and save it, but turn it so that the part that's open is facing up on the counter. And then you'll see that there is a green color here on the tip. We get rid of that one. Don't try to put that back on. I've watched patients do that and they actually stab themselves, and I don't want you to do that. So that one goes in regular trash. Save the other one. And then what you're going to do is you have to clean that area of the belly so that it's good and clean for this injection. And just a little key with your shots, guys, and I'll show this with my arm, is when you're pinching the skin for a fatty shot, you want to give a gentle lift. If you squeeze really hard, you're going to bruise. So sometimes when patients come to me with bruising, I actually have them lift gently so that make sure that they're not squeezing so hard. It's just we're kind of nervous, so we squeeze a little harder, and then that can cause trauma to the skin. So it's this one, it's a gentle little squeeze. Again, we do not have to jab this needle. Just place it to the skin, give a little push. That needle goes all the way in. Once that needle's in, then you are going to push on the end of this pen and push all the way until you feel almost the pressure that you can't push anymore. And once you feel that, count to 1, 2, 3 and let go. Then remove the needle in the same angle that it went in, set it down, and put a little cotton ball to that area. Wipe it if you need to. Usually you do not need to Band-Aid these areas because literally the bleeding stops very quickly, and you'll be able to touch the area after you've given the shot because you won't have felt anything other than the pinch of the needle, which is like a mosquito bite, and usually you will not feel the medication going in. Now what I do is I take a look at that dial, and I do have a 0 in my window there. So that tells me that this pen has more medication. So what I'm going to do is I take the cap and I put that needle into that cap, and I give it a little pinch, and I twist that dirty needle off that I used. I discard it into a sharps container that I will have from the pharmacy, and I reattach the pen cap, and the pen goes back into that refrigerator for your next use. So keep in mind, this medication is subcutaneous, meaning it's a little fatty shot in those thigh or belly. It contains FSH, which is the follicle stimulating hormone, which helps your body recruit and develop those multiple eggs, whether it be that you're doing this for insemination or for IVF. Hope this helped you with your Gonoloft, and best of luck with that medication. Craig, you can let me know when we have any questions from anybody that's on Facebook or through Zoom. Be happy to answer anything that you might have regarding your Gonoloft ReadyJect pen.
Perfect. Thank you very much. So one did just come in. So I know you had mentioned a little bit about some of the how to store the Gonoloft pen, but a specific question that came through probably because of how hot it was today. Somebody said, I plan to travel over the summer. How should I store the pen while I'm on a road trip?
It's a good idea if you're on a road trip and you're taking a road trip and the cars obviously that we're in can get hot, especially if they're, we're in stationary and we're not moving around. Some people, what we recommend sometimes is to take like a little lunch bag. You could put a little ice pack in there that can keep it cool and just keep the pen right in there with the ice pack, and that should work. If you think it's going to be an extenuated time, then maybe put a couple little ice packs in there. But that's something that the pharmacies actually do put that in those boxes when they're sending and shipping the product to you. So that's why it's important, even on these warmer days, that's a part of what the pharmacies will do. And that's also why it's a good idea to do that with just a little ice pack and a little lunch bag yourself to keep it insulated, and it'll keep it cool.
Perfect. Thank you very much. Another question that just actually came in right here, a little bit, Matt. So you had discussed the idea of how when you know there's extra left over at the end of a shot. This is about specifically for a dual shot situation. If I don't have enough medication left in the pen for a complete shot, do I need to take the 2 shots? And if so, how can I make sure that I'm giving myself the right amount on the second shot?
Well, usually what I suggest to the patients is the numbers they need to be concerned with is definitely the amount of medication that your nurse or your clinic is telling you to take. So that's always the amount that you need to administer for that one shot. So in my example of the 150, if your injection is 150 for that day, when you dial to 150 and you inject, if there is enough medication in that pen, it will go to 0 and then you're good. You don't need to administer anymore. If you do notice, though, that when you turn to the dial and you administer, there's a number left in the window, then yes, you will need to open a new pen, because you're not going to get that medicine from that pen you just used, because now it's empty when it's not at 0 after you give an injection. You have to open the new pen, but you only give the amount that the number on that pen that you used previously stopped at. You don't dial it to 150 again. So if the pen stopped at 50, you would just turn that new pen to 50. So that's not going to happen very frequently in cycles for the length of time that you're on these medications, this particular medication, in terms of changing and doing 2 shots every time. It's really going to be that it might happen periodically in the cycle, but it's not very frequent when it happens. So occasionally there'll be a night here or there that you might have to administer 2 separate injections, because you would have to use 2 separate pens.
Thank you very much for explaining that. This question just came in on Zoom. I believe it is from Monica, and it says, is there any specific time that I need to take my Gonoloft? I was advised anywhere in between 6 to 8 p.m., but would it be the same time every day? And again, I know we did just touch on some things are going to be different based on the clinic that they get it from. So this is one of the
right. So I wouldn't want to even say AM versus PM, because clinics, we all, at different clinics, different physicians do different things with their patients in terms of timing. But what I will emphasize is your clinic will always indeed provide you with your time to take your medication. So that's what's important that you want to know, is your clinic will always give you your time, whether it be evening or morning. And so you just want to follow. And sometimes there will be a range of time. So sometimes some medications, it's not a very specific time, it's a range. And then within that range, you can administer the injection.
Perfect. Yep. Thank you very much. And again, this is just a perfect time to bring up anything specific like that. Always default to what you hear and what you are told from your healthcare provider, from your clinic. That they are always going to tell you. Some clinics do things differently, and they're going to tell you what they want. If there's a specific time, they're going to tell you when. They are going to share all this information with you, and those things are the non-negotiables. This is a little bit more on just technique and so forth, and those are the things that we can guide you through, and what Wanda is going to be able to help you with moving forward throughout this program. But we just wanted to let people know no questions are off the table. You feel free to ask any question whatsoever, and we will give you the best answer that we possibly can with all of the expertise that Wanda has, that she is sharing with us today. So,
and I would just add, Craig, quick, it's kind of like when you go to a pharmacy and you pick up a prescription that's for any medical issue that could arise. A physician is always needing to provide the pharmacy with the name of the drug, the dosage that they're giving you. But when it comes to specifics about what to take, when to take it, how much you're taking, all your doctors are reinforcing that, especially in a fertility clinic. That's real important stuff. So with that, the responsibility is on the nursing and the physicians at your clinic to provide that information. And if you're ever unsure, by all means, contact your nurse and your physician.
Perfect. And so this question just came in. This actually came in a couple times, so this seems to be a bigger question for people. Should I ice or heat the area before injecting or after? Does it matter? What works best? What are your recommendations for that?
With the little injections, you know, we all have kind of experienced getting a blood draw, and believe it or not, having your blood drawn, and most fertility patients do that at multiple times to give you something that you've done before, that you've been successful at experiencing with those blood draws. So I want to help you feel calmer with these medications. Is these medications that go in the fatty tissue, literally a little teensy pinch like a mosquito bite, and many of us have had a little bite by a mosquito. So I just want to give you something that you can go by that really hasn't been quite so bad. Is a little mosquito bite is the pinch of these medications. So sometimes we're often a little hesitant with the little shots to maybe say to ice beforehand because they aren't going in very deeply. And because of that, you have little threaded little capillaries that help deliver that medication to where it needs to go. And sometimes if you are icing too much, you could be constricting that little capillary. So usually with the belly or the thigh shots, because they feel just like a little mosquito bite pinch, even less than a blood draw, sometimes you don't even need to really do anything in terms of icing or heating.
Perfect. Sounds good. And so as of right now, Wanda, that is actually the last question that's come in as of right now. So we will give everyone some extra time if you want to, if you need extra time to type in your question. One thing I always do like to add, we will have a section at the end after the third product for where you can feel free to ask any questions about all three of the products. So you don't have to feel like you have to rush it to get it in right now. If you think about something, feel free to ask at any point in time. But we are all caught up on questions right now. So
Okay.
Wanda, if there's anything else on your end that you want to share, otherwise we can move on.
Yeah, just the next thing I was going to say for the next product is just a little info to share is the next medication is Gonoloft multi-dose, very similar to the pen, still FSH. However, it's in a little vial that has a little powder or a little powdered tablet, and you're doing some mixing. So different than the pen, meaning the pen comes all together in one little pen and it's already liquefied. The reason sometimes your clinic might give you one over the other, it really depends. Sometimes some people have an out-of-pocket expense. They might be a self-pay, so it might be worthwhile for them to try a different product, meaning it does the same thing. It's just we have options, which are great. It's great that we have options like this. So this Gonoloft multi-dose, one thing I always like to add before we watch that video is that it is similar to cooking. You think about cooking, you have a recipe with fertility products, you have the supplies, and then you have a list of steps. And the same idea here is there's going to be a list of steps, or what I'm going to share in the video. And you have some solid and some liquid, and it's really easy. It's really not as complicated as you might think. So even though this Gonoloft this multi-dose has a mixing step, it's also a nice, really way to get your medication, and it's convenient and easy to use, and you'll be seeing this. So the Gonoloft that's coming up is a kit that we will show. So Craig, you can get started with that next video to show us the Gonoloft multi-dose mixing product. This video is to help you with the multi-dose Gonoloft with mixing and administration. If you've been prescribed multi-dose Gonoloft, Gonoloft is an FSH product, follicle stimulating hormone. So you're taking that product to actually stimulate the ovaries to produce multiple follicles, which in turn produces multiple eggs, preparing you potentially for egg retrieval or for even an intrauterine insemination. So it's just good to know why you're taking something, because I think that's the first big thing to know. So that's the reason, is that it's going to help you produce multiple eggs. Next thing is, how is this medication administered? This medication is a subcutaneous injection. Sometimes nurses will say it's in the fatty tissue. So that's correct too. So to keep it a little less clinical is to say that it's a little subcutaneous injection using a small needle that's going to go in your lower abdomen, lower belly, or your upper top or outer side thigh area. That's strategically where we usually have our patients at our clinic, and I think most patients at the clinics are doing it, that injection in those areas. But again, you would always contact your clinic, your nurse, your team, just for verification, and they will always review with you your dosage and the injection technique and the area to inject. Lastly is this medication, because it is in the subcutaneous or fatty tissue, you could self-inject. So think of insulin when patients before pumps were administering a medication that was needed to be learned by them. Oftentimes diabetics know how to do their own injections. So this is kind of like that. The difference between that is that for diabetes, that's for their lifetime. For your window of fertility, there is a beginning and an end to the injection during the cycle. So I want you to know that. It's just to realize that with each of these medications that we will review or sometimes have you taking, there's always a starting point and there's always an ending point. And there'll just be a brief period of time that you might be taking it to help the action of what that drug's to do. So next step is your supplies that are needed for this medication are going to be your multi-dose kit. You may have a smaller box than this from the pharmacy, but this is a little demonstration kit of mine, but you will have a box similar to that. And in that kit, what you will have is 1 vial of powder. So the medication of multi-dose comes in a vial, but it is in powdered form. And a lot of times the nurses call it a powder, a tablet, a wafer. There's no wrong way to say that. There's just many different ways to say the same thing. So that's what you want, is that 1 vial. Know that that's the medication, is that 1 vial. And it's a multi-dose. We'll talk about that a little more. The other thing that you will need is 1 pre-filled syringe that is provided in your packet. You have a pre-filled syringe that is provided with sterile water, bacteriostatic water, and that's going to help to dissolve the powder that is in that vial. And then you will have 1 Gonoloft, 1 milliliter, 1 cc, and it does have attached to this one a 27 gauge half-inch needle. And there'll be multiple of these because you're doing that injection for more than 1 day typically. On average, just to put it out there, sometimes anywhere between 7 to 10 days that you might be taking this. Could be a little more than 10 days, but on average, 7 to 10 days of an injection of multi-dose. And so the supplies you need is, finishing it off is this injection syringe, which is a Gonoloft 1 milliliter syringe, but it also has the appropriate size little needle for the type of shot that we are going to do. So as with all the videos or anytime I'm showing mixing of medications, I always remind you that it's not sterile technique, but it's clean technique. So what you want to do is just always good to wash your hands. For sake of the demonstration, I'll take a little bit of hand sanitizer, but mixing medications is not a sterile technique. It's just that it's a clean technique. So it's always good to have clean hands after you've gathered your supplies. Clean those hands, if you will. First step that we're going to take is take that multi-dose vial, and in here for the simulation of this video, there isn't a powdered pellet in here, but you would have a little powdered tablet in here. When you have that tablet, you're going to uncap and hear a little click. And then what you do is, remember I do say in other videos that this is sterile under there, but it's the nurse in me to always wipe the top of that vial with a little alcohol wipe, because any surface that I'm poking with a needle, I always want it to be clean. So that's the reason I'm cleaning the top of the vial. If you ever forget that step, it's okay. Don't panic. It's perfectly fine. It's just, it's something that when you have a multi-dose vial, I want you to get in the habit, because each night you will be utilizing the same vial for your medication or your injection. And so it's very good because it'll be open to the air. That's just good to always clean that top. Okay, clean it with that little alcohol pad, or like I said, you can have your little rubbing alcohol and a cotton ball doused in alcohol just to rub that top of that vial. Then our next step is to take the injection pre-filled sterile water and uncap that needle. And what you're going to do is poke that needle through the center of that vial where there's a rubber stopper, and you're going to gently push the solution of that water, and do it gently, because the vial will have little bits of bubbles. It may actually, with that powder in there, it's going to be a little cloudy at first, but what you want to know is it's going to clear up. Sometimes what I tell patients is once you've injected that fluid into that vial, then you can remove the syringe, but then gently roll the vial. You don't have to shake it vigorously. You don't want to create a lot of bubbles. You're just kind of gently rolling, because you want to get all that little powder that's in there to dissolve with the water that you're being supplied. Now, the biggest thing that somebody might ask is, how long will this vial last me? That's a difficult question for me to answer for you with showing mixing administration. And the reason that's difficult is that I don't know your dosage. Your physician and your nurse will be developing a plan of your dosage. And so somebody who might be taking a smaller dosage each evening of this product, or each day, I should say, no matter what time of day you're taking it, your clinic will advise you. It may last you more days than someone that is taking a little bit of a higher dosage. So remember that your dosage is tailor-made to you based on your age, your diagnosis, and your history. And your doctor comes up with that plan. But for everybody that uses multi-dose vial, there is typically more than one injection in here. So that's what you just want to know, is once it's empty, you'll know, because you won't be able to draw out any more of that medication. So in the very first night, it's nice and full. And then what you do is you take your needle that says 1 ml syringe, 27G ½ inch, and you open it from its package. It's sterile in there. And with live TV, I've just actually bent the needle a little bit, so I'm going to actually put that down. See, even for me, things like that happen. And that's perfectly okay. I could feel myself bending that needle because it's very fine. So if that ever happens, I'm going to put that in the sharps container, but let me try again. See, it doesn't matter. Even you can have that happen, but even I can have it happen, so don't worry. So I'm taking out a brand new needle and syringe. And what I'm going to do is let you see that this is calibrated in international units of the drug. So meaning that when your nurse gives you your number, that's what she's referring to, is the number of units for that medication that you're going to draw up. So I'm going to use the example of if I'm drawing up 150, which this is the little 150 line. So what I'm doing is I'm drawing down, and the top of the plunger I'm placing on the 150, and I'm going to inject a little air. Because whatever amount of liquid that I'm drawing out, if I'm going to draw out 150 units, I want to equalize a little bit of the pressure that's in the vial. It just makes it a little easier if you draw up that air. It's not incorrect if you don't. It's just a little step that can help make it easier, so never panic if you don't do this, okay? But I just find that it helps it a little bit, make it a little easier to draw up. So you would insert that needle into the vial, right in the center. Oh my goodness. Hold on just a sec. There we go. Okay. Insert that right into the center, and then turn it upside down, and then you inject a little bit of air in there. That helps to sort of equalize things a little bit, and it's actually pushing down on the plunger for me right now because of that pressure. So I'll let it do its thing, but then eventually what I'm going to do is I want to gather the amount that I want, which is 150. So once I get it to the 150, I'm going to turn it right side up, and I'm going to remove that needle. A little bit squirted out because I had a little pressure there, but just so that you know, sometimes that will happen. It's not a wrong thing if a little bit squirts out. It just means you're losing a little bit of the drug, but it can happen even to those of us working with the medication, just so that you know. So if that ever happens, just go with it. You still have lots of nice medication in here, okay? Your next step will be that you're going to cap this needle until we're ready to inject. Just gently cap it. And where I'm going to see that I have a few bubbles, air is not an issue going into fatty tissue, but sometimes some of the clinics and the nurses may recommend that you give a little tap if you see any little air bubbles, because it just helps to let that air rise to the top, and then it won't be as part of your shot. But don't feel worried if you can't get rid of an air bubble, and there are many times you can't. Just let it be. The important thing to know is that this is not going anywhere near a vein, and that is when air is an issue, when it's near in a vein. This is going into your belly and your upper thigh area, so it's a little fatty tissue shot, so you do not need to worry about that air. Where it is that you're going to administer, I'm going to get my little mannequin here just to show you that. that you are going to give the injection, it's going to be in either the lower belly, okay, or the upper thigh area and side outer thigh area. No area is better or more efficient or more effective. The little fatty area in here is fine for this medication, and you would move this around for each multi-dose injection you would take. This area here, you move the injection around in the top thigh or even in the side outer thigh. So I always get asked a question of, if I use my belly, do I have to stick with my belly? No, you can use belly and add in the thighs. You could do just thigh and no belly, or you could do a combination. And whichever way you choose to do that is perfectly fine. It's a-okay usually, but your nurse will certainly guide you too as well with where the sites are. But the thing about a shot that's happening for more than one time, it's always making sure that the patient's moving it around from where they gave it previously. If I were to give this person her injection and she were laying down, I would have her lay on her back, and this injection would go in at a 90-degree angle on the belly, would be a 90-degree angle on the top of the thigh, and a 90-degree angle into her side thigh. Because you can also self-inject though, if she's standing or sitting, this would be the position of her body. So if her position of her body is that she's standing and sitting and self-injecting, the angle of the needle is going to just go straight in. And a big question I always get asked with the shots is, does all the needle go in? And you actually really do need to make sure with this one that all the needle goes in, because you're really only putting in a 1/2-inch needle. And we all have, as you can see, I'll just show you this on this mannequin, we all have this yellow area, which is fatty tissue, and it's usually more than a 1/2 inch. So the idea is that's why we're picking these areas that have good fatty tissue for you to use, but it's very important to get it all the way into that area, okay? So one of the things that you'll want to do is make sure that you clean the area with alcohol. And one of the next steps we do is we uncap the needle. We give a little pinch to the skin. So what I'll show with my arm is that when you're pinching the skin, you just don't want to pinch too hard and squeeze too hard. You could get bruises. And if you get bruising, it's occasionally happens to people when they get blood drawn or shots given. It's a-okay. You just want to make sure you don't administer another shot in a bruise. If you get a bruise, let it heal. But the key is sometimes if I see somebody that might have multiple bruises, I might have them show me the technique of their pinching, just to make sure that they're not pinching too tight. So it's really just you're lifting the fatty tissue up off of the muscle, so it's a nice, just gentle lift. I like to kind of think of it as a lift versus a pinch. So we're going to give a little lift to that fatty tissue. We're going to angle the needle straight in, and we do not need to jab, okay? No reason to trauma the skin that way. Just place it gently to the skin, give a little pinch. There's where you will feel your mosquito bite. That's exactly what it feels like when those little needles go in, is a little quick mosquito bite. Now you don't even feel it. Then we press that fluid in there. And with multi-dose, you probably will not even feel that medicine go in. Most patients that I speak to after I've taught them their shots, they'll say, wow, I was really surprised at how little you said I would feel, and I actually really didn't feel anything, and I thought I would feel a lot more. And that makes me happy, so that it reassures them and reinforces what we're teaching. And then when you remove the needle, you can do a little 1, 2, 3 count, move it gently, set it down, and then you'll put a little pressure there, just to, if there's any fluid that's moving, you want to keep it in the skin for it to absorb. And you also want to, stop any little bleeding. But usually, like a mosquito bite, you might get a little bleeding from these little tiny shots, but not much at all. With that multi-dose, the key thing to know is after you give that injection, what you are going to do is then put your vial in the refrigerator. And then on your next injection, what you can do is take it out. You could leave the vial on the counter for a few minutes, or you could draw up your dose and leave the dosage, just what you need, out on the counter for a few minutes using several syringes that you have. Because remember, it's a multi-vial dose, but you have many syringes so that you can do more than one injection. Once this vial is empty, so say you end up having a dose of 150 and you draw up 50 from this one that's just has 50 units. So draw up the 50, cap the needle, open up your new box, mix that vial with the one syringe that has the liquid in it, mix that vial, let it settle, and then take your syringe, clean the top of that vial that already has the 50 in it, and draw up the remainder 100. So you might be using two separate vials, one vial that had 50 in it and a brand new one that you were able to draw up the 100 for your total of 150. So it doesn't have to be two shots. It can still be just that one injection. But when the vial's empty, it may not be able to give you a full dosage. So that's when you mix a new vial and draw up to the rest of what you need that equals 150. Okay. So I hope that video helps you to understand the multi-dose Gonoloft product, and best of luck with you in getting started on your injection journey. So hopefully that video helped you if you have multi-dose as a part of your medication cycle, and gave you some tips with that one. And Craig, if you have any questions for me that I can help answer, I will do that.
Sounds good. So this one I may have come in right before while somebody was watching the video, because you did mostly address this right towards the end there. But the question was just around what should I do if I do not have enough left in a vial for a complete shot? And the question's obviously around taking that second shot, which you did touch on. Is there anything else that you wanted to add to that here?
No, just to reinforce, hopefully, that although sometimes people hear that drugs need some mixing or the fertility medications need mixing, hopefully, as that video had shown, it's really maybe a couple steps, but nothing that's too difficult. And like I said, if you're able to put a recipe together and follow directions and have ingredients, you're able to do that with your supplies and your directions like this video with these mixing medications.
Perfect. That is an amazing, way for people to view it and to get more comfortable with the entire process. So we may be stealing that and using that again, Wanda. Thank you very much.
All right.
A question that just came in, this is from Nicole, actually on Facebook, said, are there any prenatal vitamins that should not be taken with these meds?
You know what, that would be something you would want to ask your clinic. I mean, most often every patient, we try to encourage them to have good, proper vitamin and minerals prior to pregnancy. So the benefit we have as fertility clinics is we're seeing you preconceptually. So it's always great to be able to have this discussion with your physician. And most often there will be a prescription that is given even prior to you starting the cycle and wanting you to take your prenatal vitamin before these medications begin. So oftentimes, no, there isn't a typical conflict with the injectable medication and your prenatal vitamin. It is a part of a conjunctive therapy. It's something that we want you to be on the prenatal vitamin along with your treatment, because like I said, that's preparing you for pregnancy. So the fertility cycle is going to hopefully get us to that place of being pregnant, but we can preconceptually get your body ready and get those nice minerals and vitamins. So, they work together, the fertility medications and getting you ready for pregnancy. So usually you can take your prenatal vitamin. But if you have any questions or concerns otherwise, if you're on something, by all means, direct that to your clinic, to your nurse.
Absolutely. Thank you. And that's also obviously something that the pharmacy specifically can help you out with that as well. So you can always reach out to the pharmacist at Mandel's. We are able to answer some of these questions and talk to some of these potential conflicts that may be occurring. So it's a great way to understand that there's multiple different people here that can help you through this process, and you don't have to feel like everything just has to be you wait for this program. You can reach out to us and we can walk you through some of these things as well.
Yeah.
One other quick question that did come through, and so this is from Jessica, who I know you touched on it a little bit on the last when we were talking about the pen, but she got here a little bit late, so she just wanted us to see if we could touch on, do you recommend ice before the shot? And she just wanted to kind of know, would that help with potentially with pain or anything like that?
For the next medication, which is a great question from, I think you said Jessica, we're going to be going into a type of a patch that's a numbing cream type of patch that you could potentially ask for from your clinic and talk to your nurse and see if they could order it through a pharmacy like Mandel's pharmacy for this, the specialty pharmacies for your fertility medications. But check in with your clinic as well. I mean, we do give instructions sometimes that some medications you can utilize a little ice before. For the ones that I just have gone over that are subcutaneous, oftentimes, as I sort of mentioned in one of the videos, is that the medication's going into a very small amount of our body. It's going in only a half an inch. It's getting into that fatty tissue. And even though you do have little threads that are like little capillaries that are delivering that medication to where it needs to go, so those are very tiny. And so when we put ice on something, we constrict blood flow. So with those little injections, sometimes we might refrain from using the icing, but the Sonera that I'm going to have in the next video, which is a patch, you could possibly use that as a numbing agent to help you a bit if your clinic is okay with that. So you would check in with them. Intramuscular shots, which are seen at later videos or even some of the earlier videos, we sometimes let you use a little ice for that because those are going a little deeper and those are getting into muscle. So really what you want to do is numb a little bit of the surface, which is fine to do that then when you're doing intramuscular because it's being delivered a little bit deeper in the body and into the muscle, very vascular tissues. So certainly always ask, your nurse and your physician what they recommend. But on this video, one of the products that I will be reviewing next is a product that can help with blood draw if you have issues when you get your blood drawn in numbing that area or numbing the area for you with your injection for either shot, actually.
Thank you very much. Okay, so we have a bunch coming in right now. So let's see, from Latoya, we have the question. She says, I am currently on the second day of my cycle, starting the Gonoloft tonight. Would the medicine affect my menstrual cycle?
Good question, Latoya. Actually, it will not. The cycle that you have right now is preparing you to start your medication, so you are exactly where you're supposed to be in terms of a lot of times when women are starting these cycles, so it's a really good question, actually, is a lot of times when you're starting these medications, whether it be for insemination or IVF, you will potentially be the second or third day of your period. So absolutely, it does not affect the bleed. It won't make it less or more. This is just when your body is at what we call a baseline. All of your hormones right now are at a baseline level, and that's what your center wants them to be prior to you starting the medication. So will not have any impact on that period. So good luck with getting started, and I hope that either of those videos for you for the Gonoloft and you were able to see them will be of help.
Perfect. Thank you so much, Wanda. Okay, so right now we are we've handled most of the questions coming through. There, it looks like there's some other things that are being typed. So if they pop up and they're not something we've already touched on, I can jump back in and get to those. But if you want to give people a couple seconds, if there's anything else you wanted to share before we move on to the next product. And again, remember everybody, you will have a chance to to ask any questions about all three of the products at the end. So don't feel like you have to start typing in shorthand to get it in time. Wanda will have more than enough time to answer all of your questions.
I think I would want to add, because I'm going to go, the next product is the Sonera Lidocaine patch. So what I want to mention is, that is something that might be of help to you, but you can talk to your clinic, as I mentioned just a few minutes ago, about the icing and which areas they're okay with you icing, because ice is a nice, quick, easy way to numb an area before that needle might go in. But one of the things I want to emphasize is I've taught a lot of patients in person, a lot of couples with these medications, and I want to give you guys the confidence that a lot of people get back to us or have said to me, thanks so much for the teaching, thanks so much for the instruction, but more importantly, you really put me at ease with not worrying of how it was going to feel. Yes, I felt a little anxious getting started, but that after I did the medication, it wasn't quite so bad. So I really, really want to kind of send home that message tonight that most of the medications, that even though they're injections, and we're certainly not trying to belittle that fact, we just want to let you know that most often patients really are able to do very well, get through their cycles. And as I said in the one video, there's a start and a finish. It's not a forever thing. Just for the time and the duration that you do your cycle, that's when you're on those injections. But again, it's a start and a finish, which is nice, so that you know that there's an end in sight to them. And even during them, when you are taking them, most often everyone is really amazed at how much little that they felt that they thought were going to feel a lot, and they really didn't. So that just makes me feel good that it reinforces all of that we're trying to get that point across.
Perfect. Looks like we've gotten through everything. There were just a couple of similar questions that we had already answered, so that we're good on that. The one thing I will just let everyone know, if you have any follow-up questions from even somebody else's question that you think of a different question that you want to ask a follow-up on, feel free to also add that into the mix as well. So just wanted to throw that out, but otherwise we are ready to move on to the next product now, Wanda.
Okay, so our next product that Craig will be bringing up that video for us is the Cinera, which is a transdermal lidocaine type patch that your clinic could possibly look into ordering for you through the fertility pharmacy like Mandel's Pharmacy, and be able to help you, be able to calm you if you're worried about anything with these needle sticks or with your blood draw. So without further ado, Craig, you can go ahead and run that video for us. Hi everyone, this video is to give you some instruction for using a numbing patch that's available to you if you have difficulties with having shots administered and you're very concerned, or sometimes some people have a tough time getting their blood drawn, and this can be a useful patch to have your center call into the pharmacy, and the pharmacy will check and see what your coverage is for it. But the idea with the patch is just to give you another option of something that might help you in alleviating any fears about blood draws or medication administration. So this medication is called Cinera. It comes in a box that will look like this. Oops, pardon me. Let me put it the right way. And then there are, I believe, 10 patches in here per box. Each patch is a one-time use, so you don't reuse the product. Once you apply it, kind of think of a Band-Aid. You apply a Band-Aid and it might get soiled after you discard it. So each patch is a one-time usage patch. And so when you are applying this to have either a blood draw, okay, or to an area that might be getting injections, which sometimes for fertility mainly could be the buttock area. Some people might want to apply it for the little areas, shots that are in the belly or the upper thigh. But once you get the okay and you have a prescription that does get called in for you, what you want to know is, make sure that the skin area that you're putting this on is not having any cuts or any abrasions or anything that's an open wound. You want it to be clean skin, but you definitely want to make sure that you have no cuts or abrasions or anything like that on those areas. So you would clean the skin first and foremost. And what you'll see is the patches come in a packet, and you will open up that foil pouch and you'll remove the patch and place it with the foil side up. What you'll find here is there is a little sticky, there's a little sticky area here that I will pull off, and then there's a little a harder plastic area. When this goes on is typically 20 to 30 minutes prior to getting a blood draw or getting a medication administered. So you want to apply it to that area. Careful that you don't touch the area that has, you'll notice that there's some little dots in here where it breathes, the Band-Aid. But once I remove this, like a lot of times even Band-Aids that might have a little bit of medicated Neosporin already in them or whatever, you don't want to touch that area. So same with this, is that you don't want to touch that area. And then you peel it back and off. And so this is the part that's going to stick to the body. And then just for the sake of my demonstration, what I'll do is I'll grab my mannequin that I have. And if we were going to have her, for her muscle shot, utilize this, we would take the foil side down, not touching it, and apply it 20 to 30 minutes before where she's going to get her injection. And she would leave it on, or she would apply it, I should say. She would apply it to that area, leave it on there for 20 to 30 minutes, and then remove it prior to the injection. When you do go to remove this, what I want you to be careful of again is not touching the inner aspect, that silver part. And so in order for that to be safe for you from animals, from other children or anybody, is your packaging. What's nice is you can just apply it to that packaging and then discard. So save the outer foil pouch to be able to utilize that for discarding your patch safely. So there's a bit of numbing cream, lidocaine, there's a little bit in here. And what those, like I said, those numbing agents can be helpful for some people who maybe really have a potential needle phobia, very concerned about their injections, even, might be a little bit of a difficult blood stick. So this is something that you can always talk and discuss with your fertility clinic, your nurse, your team, and let them know your concerns, because I think all of us would agree that we want you to be able to get through your cycle. We want to do everything we can to empower you to feel comfortable. And so if this is something that is going to help you to make that next step and take that next step to the fertility journey, then we want you to know there's some things out there for you that can help. Thank you again, and best of luck on your journey with your fertility cycle. If anybody happens to have any questions for us about the Sonera patch, one thing I was thinking about is what you might feel when you put that patch on. There is a little warm feeling that you might feel on there when it's applied, and that's helping the medication to deliver. So it's, that's one thing that sometimes I don't think I happened to mention in the video, but wanting to know what you would feel there. It should be that you might feel a little warming, but it's going to be numb. So that's the goal, is that it's providing that numbing feeling.
Thank you very much. And so this question came in. It says, will the patch still work if I forget to put it on for more than only about 5 or 10 minutes before my scheduled injection time?
Well, the product, the manufacturer states the 20 to 30 minute time frame. So if you put it on and you're only at 5 to 10 minutes, it may not completely provide the full numbing effect. You could try it. Certainly, I guess it's better than not. If you're somebody that's using it, and one night you have to go out and you have to do this fast. So you could try that, but I think you have to understand that you may not quite get the full numbing effect, but don't save that patch. Once again, even if you're only using it 5 to 10 minutes, you then need to discard it and not use it. So, so just keep that in mind if it is that you only have 5 or 10 minutes. Maybe you forego it so that you don't waste a good patch.
That's a good point. Now, thank you very much on that. And then this, I guess, would be the flip side to that, is question coming in saying, can I overdose on the medication if I leave it on for too long?
They do recommend not leaving it on more than the 30 minutes. And the reason for that is because you are numb after that. So leaving it on too long is definitely not recommended via the manufacturer instructions. So set a little timer. We all have our phones in today's day and age. Set it for the 20 to 30 minutes and definitely remove it. More is not better in this case. So you want to remove it after that 20 to 30 minutes. And, be careful, because if you keep it on too much or don't double down and put more than one patch on for 20 to 30 and then another one, that's absolutely not recommended as well. Because again, it really is delivering a nice dosage for you for these shots and or blood draws, but you don't want to overdo it. And then you might not know when you're in contact your skin with something hot and you could burn yourself in that area, or you could, you have something too cool. So, because it is numb. Keep that in mind. So you don't want to overdo it. Definitely do not overdo it.
Yes, and this is also, again, a perfect time to say, just treat this like any other pain medication, or in this case, any of your other fertility medications in general, that there's specific reasons why your clinic has given you the instructions that they have, and that the medications come with the instructions that they do. So you should always follow those instructions to make sure that you are using it correctly and getting the best utilization for each one of these different medications.
Absolutely.
Well, it seems like this one always tends to be, it's a little bit easier. So it's a lot of people are more worried about too long or too short. I don't think there are too many other questions coming in. So this is a perfect time to throw it out there and say, if any questions that you've thought of about any of the different products that we've talked about, all three of them, Gonoloft pen, the Gonoloft multidose, or the Sonera patch, if you asked a question or you heard a question that was asked that you have a follow-up question from, feel free to add that now. It's kind of an open forum right now about anything that we've discussed so far. We'll put it out to the entire group. While you're thinking of questions, Wanda, I will turn it back over to you as we kind of start to wrap up the program tonight. Mm-hmm.
Okay, so again, I would want to say I I hope that you are able to continue to tune in at 7 p.m. and to the Facebook Live Zoom events. That this PharmAssist program is all about giving you some real helpful tips. And hopefully, again, like I said at the beginning, trying to simplify the complicated, because we realize that the medications is a very, very big part of fertility cycles, and we want to do whatever we can as nurses, as clinics, as pharmacies. We rely heavily on Mandel's Pharmacy with our patients for medications, and they are always there. That open the box, as I mentioned in the beginning, by all means, open that box. And what you want to do with that is when you do open that box, you are, if you have any questions, you can contact right away to the pharmacy even, because they're the ones that shipped it out to you. And we rely on that aspect. We're very much a collaborative part of this with all our pharmacies, and Mandel's Pharmacy as well. It's been so important with them doing this patient education. The last thing I wanted to say is one little tidbit. So I am also a certified healing touch practitioner. Some of you may know and have heard of Reiki. So Reiki is energy medicine. I can't speak upon Reiki because I'm not a Reiki certified person, but I am healing touch. Healing touch was developed in the late 1980s by a holistic nurse for nurses, but anybody can become certified, even a lay person. And really what it's all about is that we are a bioenergy field, meaning that I'll give you a great example. Have you ever walked in a room and you got a vibe from somebody? You just got a great vibe. They were really like, wow, you were attracted to, you didn't touch them physically, but you felt like they were so positive, their energy. And so energy is real, energy medicine. And so to get you going with these medications, a little tip that we're going to have available via Facebook, I believe Craig has said, is something called a self-mind clearing. And it'll be looking a little bit like this. And what I want you to know about energy medicine is that when you're feeling a little stressed, a little worried, got a tension headache possibly, and thinking about these medications, this is a wonderful technique. Each box represents holding a position for 1 minute. You can be your own certified healing touch practitioner, just meaning that you can do your body a good way to promote your own sort of calmness and relaxation. So you turn on a little meditation music, find a little guided meditation if you want to, lay down, sit up, and then you follow the directions on here. And so, for example, one of the little hand positions is to put one hand on your brow and one hand on the back of the head. And what I want you to think about is good words and good affirmation. I can do this. I am safe. I am capable of getting through my cycle. I am excited to get started. Because our body listens to our talk, whether it's good or bad, so why not put in all the good that you can to help you get started? So this is just one of my little tips for you guys to use for your cycle, and you can utilize it at any time during that cycle. And it's good for partners, it's good for men, women, and children. So if you have children that study, or know of nieces and nephews that study in college, it's a great little tool, and it's a great little tool for you guys to use in helping give you a calm before you start that cycle and get you good and prepared.
Perfect. Thank you very much. And Wanda, as Wanda mentioned, we did share that page with the steps on our event page for tonight's event. It will also be going up onto the main Mandel's page after the fact, where you can take a look at that. You can pull up the page itself. You can print it out and use that as something to relax yourself in the coming days, weeks, months. We all know we could use some relaxation now, so that is perfect. So thank you, Wanda, very much. I want to thank you so much for your time today and for all of your time tonight with the questions and answers and walking people through and really making everyone feel very comfortable with everything that you did. That is our main goal here, is to educate you and let you take away something from this, but also to really feel comfortable and confident that you will be a pro at this by the end of this video and at the end of these presentations. So every Monday night, as Wanda mentioned, we will be doing these at 7 p.m. We have amazing expert nurses from all around the country that come on and join us in these different programs. We do different products throughout the course of the different programs, so you can get a chance to see what products you're on. You can also take a look for those videos on our YouTube page. individual videos, as well as this entire archive of the video we just did today. That can be found on our YouTube page. You can find that also on Facebook, where you just were watching this. You may have just been watching this tonight. You can also go to our Mandel's Pharmacy page, where you can find all of this stuff listed there for you, as well as links to get back to this show each and every Monday night. So thank you again for all the amazing questions that we got from the people that joined us on both Facebook and Zoom. We appreciate it. Feel free to share this with anybody else that you know that could benefit from a conversation like this. And we look forward to seeing you all again next Monday night at 7 p.m. right here at the PharmAssist program, brought to you by Mandel's Clinical Pharmacy. Thank you very much, everybody, and have a great evening.
Thanks, everybody. Great evening.